Latin American immigrants in the U.S. face significant challenges in healthcare access and quality due to risk factors like lack of insurance, language barriers, and fear of deportation. These issues often lead to delayed care, poor chronic disease management, and lower rates of preventative services. Improving culturally competent care and expanding access to affordable, safe healthcare is key to reducing health disparities in this population.
For many Latin Americans, a language barrier can mean the difference between life and death, and nearly one-third of hospitals in the U.S. do not offer patients interpreter services. In the U.S. alone, about 47% of Americans speak English proficiency, and about 63 of those immigrants speak Spanish only. This can cause patients to have miscommunications with healthcare providers, and some may even give up communication and seek care in general due to the lack of understanding. This also leads to medical errors and overlooking emergent and critical conditions. This all then leads to poor patient outcome. Interpreters should be used in all hospitals and healthcare clinics in order to help improve Latin Americans and other immigrants' patients' outcomes.
3 things that healthcare workers can use to improve their care for the Latino population is understanding their family dynamics. The Latino population is very family oriented, so this would look like involving the family members on discharge teaching or discharge instructions, as well as medication instructions. And this could also be a contributing factor to help the patient stay from the hospital because the family member can help with those instructions. Second is respecting their cultural beliefs. Majority of the Latino population is Catholic, so this could influence their perspective on healthcare as well as their perspective on taking certain medications. And lastly, but one of the most important factors is ensuring effective communication. Even if they can speak English, it's best to always get a translator, especially when you're giving important instructions, medical instructions, so they can understand everything. And this also is a contributing factor to keep them from the hospital.
There are a lot of great local resources located here in Charlotte, North Carolina for immigrant families, 2 of which are actually located on Central Avenue. One of them is the Latin American Coalition. They help immigrant workers with resumes, job training, and small business development. They also provide free legal counsel and civics classes to help prepare for the citizenship exam. This organization is accredited by the Department of Justice, so you know that they have really reliable resources here. You can go to latinamericancoalition.org for more information for the services they provide. The other organization is Project 658, and they specifically have really great educational resources. They tutor kindergarten through 3rd grade immigrant students after school, and then in the summertime, they help to tutor and do summer camp for kids of all ages. For adults, they also provide English as a second language classes, as well as college tutoring. And to see the other services they provide, you can go to project658.com.
The word salud is the translation for health in Spanish, and we have decided to use it as an acronym in a way to remember some of the complications the Latin community face when it comes to healthcare. S for support, A for access, L for language, U for understanding, and D for dignity. I think these 5 topics really capture some of the things we've spoken about and some of the main complications that the Latin community do face in healthcare.